So I want you to imagine that someone hands you like a totally blank index card.
Okay, a blank index card.
Right, and you have exactly that much space to write down how to keep a badger hunting dog thriving for 15 years. I mean, it's a pretty intimidating thought experiment.
Oh, it is. It really is.
But today we are diving into what is essentially a masterclass in canine longevity. We're doing a deep dive into the season finale transcript of the Dachshund Health Academy.
Yeah, they took this absolute mountain of veterinary data and somehow distilled it down to that single hypothetical index card.
Right, and the wild part is that the number one secret to keeping a dog healthy is, well, it's actually entirely boring, but in a good way.
Boring is honestly the highest possible compliment here.
Right. And even though this is all about dachshunds and their badger hunting origins, the insights on habit building are just a gold mine for any of you listening who want to understand long-term health mechanics.
Because whether we're talking about canine biology or even human health, we're always so naturally drawn to the dramatic interventions, you know?
Oh, totally. We want the quick fix.
Exactly.
Yeah.
We want the major overhaul or the expensive miracle supplement. But the biological reality of a long, healthy life is just far more mundane. The goal today isn't to overwhelm you with a textbook of symptoms.
Right. Nobody wants that.
Exactly. It's about uncovering the overarching philosophy of how a few small choices compound over a 15-year lifespan.
Okay, let's unpack this, because the source explicitly states that lifelong health isn't just one big decision. It's built from small, boring, repeated choices.
Yeah, it really is the architecture of habit building.
It totally reminds me of financial compound interest.
Right.
Like if you want to retire comfortably, you don't just wander around hoping to find buried treasure in your backyard.
I mean, that would be nice, but yeah.
Right, but you actually put a little bit of money away from every paycheck, month after month, year after year.
Exactly.
A single epic 3-hour hike on a Saturday doesn't matter nearly as much as a consistent pattern of appropriate 20-minute walks every single day for a decade.
That financial analogy is just spot on, because in the early days of a puppy's life, that baseline effort doesn't really look like much.
They seem indestructible anyway at that age.
Right, they bounce back from everything.
Right.
But it is the accumulation of that baseline over years that yields the massive payoff later. Consistency beats intensity every single time.
Okay, wait. I have to play devil's advocate here for a second, though.
Go for it.
Because you mentioned earlier that these dogs were genetically engineered to hunt badgers. And badgers are vicious, tough animals that live in underground tunnels.
They are incredibly fierce, yeah.
So if dachshunds are so genetically tough, why do we have to treat them like fragile china? Doesn't babying them contradict their actual biology?
That is the ultimate paradox of the breed, honestly. Like, if we have to pick just one physical health principle to prioritize above everything else, what is it and why?
Yes, they have the heart of a lion and the prey drive to take on a badger in a dark tunnel. But to fit into those tunnels, humans engineered a really extreme physical frame.
We elongated the chassis of the car, but we didn't give it a stronger suspension system.
Oh, wow, that's a great way to put it.
So if we have to distill our index card to one physical principle above all else, it is maintaining a lean, healthy body weight. Period.
So it's essentially an engineering problem then. The spine is basically a long suspension bridge, but it only has the same number of supports as a normal, square-built dog.
Exactly that. And gravity is just constantly pulling down on the center of that bridge.
I never really thought about gravity like that.
Yeah, any extra weight on that frame doesn't just mean the dog pants a little harder on a walk. That extra fat translates directly and immediately into continuous mechanical shear force on the vertebrae.
So the heavier the dog, the harder gravity pulls on the middle of the bridge.
Precisely. And crucially, weight is one of the only major health risk factors that is entirely within your control as an owner.
Right, you can't control everything.
You can't control their genetics or random illnesses, but you have absolute authority over what goes into the food bowl.
That makes the math terrifyingly simple, honestly. If you keep them lean, you reduce the constant daily pressure.
Yep, you do.
But what about sudden, acute impacts? Like, how much damage does just hopping off the couch actually do?
Well, the source material really emphasizes that spine protection shouldn't be a list of strict, rigid rules. It has to become a permanent mindset.
Meaning just being continuously conscious of elevation changes in your environment.
Right, it has to become ambient. Let's look at the mechanism of what happens during a jump. Think of the intervertebral discs, so the little cushions between the bones of the spine, like jelly donuts.
Okay, jelly donuts, I'm with you.
When a long dog jumps off a bed and lands on their front paws, the The shockwave travels up that long bridge and violently squishes those donuts.
Yikes. So one jump isn't necessarily going to rupture anything, but it's the repetitive nature of it, right?
Exactly. It is cumulative trauma. One jump is fine, but jumping off the bed 3 times a day for 5 years, that is thousands of
And the
shockwaves.
donut just can't take it.
Right, the outer layer of dough on that jelly donut starts to fray and weaken and calcify. Eventually, it takes almost no force at all for that jelly to bulge out, hit the spinal cord, and cause paralysis.
So by engineering the environment, like using ramps instead of jumps or relying on baby gates, you're systematically removing those thousands of microstresses.
Yes, and even how you physically pick the dog up plays into this entirely.
Oh, right. The source says you're supposed to use supported lifting, scooping them up like a football, right?
To supporting both the front chest and the rear end simultaneously.
Because if you just grab them under their front armpits and haul them upward, you are basically stretching that jelly donut spine out.
Ouch.
Yeah, you're letting the entire bottom half of the dog's weight dangle from the middle of their back.
Which is incredibly destabilizing, I imagine.
It really is. You are introducing vertical torsion to a spine that is strictly designed to be horizontal. I love the analogy the source uses for creating this safe environment, though. They compare using ramps and scooping the dog up to automatically locking a door behind you when you leave your house.
Oh, it's a perfect analogy.
Right. You don't agonize over locking the front door. You don't write a to-do list for it or complain about how hard it is. You just turn the key.
Exactly.
It ceases to feel like a chore. It just becomes the ambient way the household operates.
What's fascinating here is how often people get the timeline of this environmental engineering completely backward.
Really? How so?
There is a very common misconception that spine protection is just for fragile, clumsy puppies.
Oh, I can see that. People are super hypervigilant for the first year.
Exactly. And then the dog hits 2 or 3 years old, they seem robust, they zoom around the yard, and suddenly the ramps get put in the closet and all the rules relax.
That is such a dangerous trap. You see this muscular adult dog acting invincible, and you think, oh, they outgrew the fragile phase. They're totally fine.
It is the exact opposite of reality. The text makes this incredibly clear that these habits matter more, not less, as the dog ages.
Because of that cumulative wear and tear you mentioned earlier.
Right. The older the dog gets, the less moisture and elasticity they have in those jelly donuts to absorb the shock of a bad jump. The dough is drier and more brittle.
So spine protection isn't a phase you just graduate out of.
Not at all. It is a permanent, lifelong feature of living well with this specific architecture.
Okay, so we've got keeping the weight off to reduce constant gravity and using ramps to stop acute impact. Those are our twin pillars.
Exactly the foundation.
But how do we actually achieve that lean weight on a daily basis without over-exercising a dog that has a delicate back? Here's where it gets really interesting.
It does, yeah.
Because the source points out that nutrition and exercise aren't two separate topics. They are two sides of the exact same coin.
They really have to be in perfect, continuous dialogue with one another.
Meaning, if their activity drops, you have to drop the food too.
Yes, if you notice your dog is slowing down slightly as they age, you have to honestly and ruthlessly adjust their food portions down to match.
That makes sense.
You simply can't feed a senior dog the same cup of kibble you fed them when they were a 2-year-old dynamo.
And the exercise itself doesn't have to be this exhausting athletic endeavor, right? The source advocates for regular, low-impact movement, just good, steady walks.
Right, we aren't training them for a marathon here. Appropriate play and walks are usually plenty.
But this is the part that genuinely blew my mind. They specifically highlight mental engagement, like scent work, as a primary tool for weight management.
It is a profoundly underutilized tool, honestly. Think about it. How do you tire out a dog that was genetically bred to hunt badgers without physically breaking their spine?
You have to work their brain.
Exactly. A dog's olfactory bulb, the part of their brain dedicated to processing smells, is massive compared to ours.
Wow.
When you make a dog do scent work, like hiding treats around the living room, you are firing up a massive neural network.
Because the brain runs on energy, so thinking hard actually burns calories for them.
Yeah.
That is so wild.
It consumes a staggering amount of mental energy and glucose. 10 minutes of intense sniffing can tire a dog out as much as a mile-long run, but with absolutely zero mechanical impact on their spine.
Which directly prevents the boredom-induced lethargy and begging that leads to overfeeding in the first place.
Exactly.
So you're maintaining the weight, protecting the spine, and keeping them mentally sharp.
Yes. And there is a hidden secondary benefit to this daily routine that the source brings up, which I think is just crucial.
Oh, what's that?
Doing these mundane, boring daily routines establishes the dog's baseline.
Right, doing the portion control, the ramps, the scent work. It builds the owner's deep familiarity with what normal actually looks like for that specific animal.
It becomes almost unconscious. You just know their rhythms.
But let me push back on that for a second because I think a lot of listeners might fall into this trap. Why is knowing the baseline so important for me, the owner? I don't have a veterinary degree, you know?
Sure, that makes sense to wonder about.
Shouldn't I just take the dog to the vet for their annual checkup or when they start limping and let the medical professional tell me if something is wrong? Why do I need to be the expert on my dog's baseline?
Well, because a veterinarian, no matter how skilled, is only ever seeing a snapshot. They see your dog for maybe 30 minutes, once or twice a year, in a brightly lit, highly stressful clinic environment.
Ah, right. And dogs hide pain when they're stressed.
Exactly. They are predators,
Yeah.
but they also prey, which means they are masters at masking pain. Your dog might be acting completely alert and fine on the exam table out of sheer adrenaline.
While I'm watching the entire movie at home in a relaxed environment, so the underlying skill isn't about memorizing a list of symptoms.
Right, your job is not diagnosis. Your job is noticing deviation. You hand the deviation over to the professional to diagnose.
I'm not supposed to be, like, feeling their spine for inflammation. I just need to know they're normal so flawlessly that a millimeter of shift is glaringly obvious.
Yes, if you watch your dog walk up their ramp every single day for 3 years, you know their exact rhythm. When they suddenly hesitate at the bottom of the rank one Tuesday morning, that hesitation is a red flag.
Or if they hunch their back over their food bowl when they usually dive right in.
Exactly. Changes in mobility or appetite, you can only spot the abnormal if you are intimately acquainted with the normal.
Which means these boring daily habits are actually a diagnostic tool. And once you spot that deviation, you need a partner to help interpret it.
Yes, you do.
This transitions perfectly into the role of veterinary care across the dog's lifespan.
Right, the vet relationship is the backbone connecting all these daily observations together. It is a true collaborative partnership.
The source outlines the key pillars of preventive care: regular visits, vaccinations, parasite prevention, and, this is a big one, consistent dental attention.
Dental care is huge, and it shouldn't just happen when problems become visibly obvious.
Yeah, I want to pause on that, because why is dog dentistry so critical to their overall lifespan? It seems like something people brush off.
It is a common and very dangerous pitfall to ignore the teeth until they look bad. By the time you can easily see severe brown tartar or smell rot from across the room, the dog is already in silent pain.
And the source points out that dental disease isn't just a mouth problem, it's a systemic problem.
Yes, those inflamed, bleeding gums are a direct highway for bacteria to enter the dog's bloodstream.
Oh, wow. So dirty teeth are actually attacking their internal organs.
They are. That chronic bacterial load taxes the immune system and can lead directly to heart valve infections and kidney damage. Routine dental care prevents that systemic inflammation from shortening the dog's life.
And there's a really reassuring note in the source about this vigilance. They remind owners that noticing a subtle change and going to the vet isn't you assuming the worst or being overly paranoid.
Right, it is just good, attentive ownership. But this raises an important question regarding the unexpected, because emergencies happen even with the absolute best care.
Yeah, the source heavily stresses the logistics of preparation, essentially reducing your own cognitive load before a crisis ever hits.
Because in a moment of panic, say your dog suddenly loses the ability to use their back legs at 2 in the morning, your cognitive load is maxed out.
Adrenaline is spiking, clear thinking is just gone.
Exactly. You absolutely do not want to be frantically scrolling on your phone, trying to read reviews for open vets near me while your dog is crying in distress.
You want to know exactly where the nearest 24-hour emergency clinic is located months before you need it, and understanding your regular vet's after-hours policy.
Right. Do they have a triage line, or do you go straight to the ER? Having that decided beforehand is crucial.
And a huge part of that preparation is having accessible records. The source highlights keeping well-organized records. They mention using the VitalPet app to keep vaccination history and those daily baseline observations in one place.
Which is incredibly helpful.
And their point is brilliant. You aren't bringing an app to the vet to play armchair doctor. You bring it so in that 2 a.m. emergency, you hand a clean, organized data set to a vet who has never met your dog.
It removes all the guesswork and accelerates their ability to treat. And for your regular vet, It lets them see long-term health trends over years, rather than relying on fragmented memories.
So if we step back and look at the whole 15-year timeline on our index card, how does all of this actually change over time?
Well, the core philosophy stays the same. Keep them lean, protect the spine, know the baseline.
Hmm.
But the application shifts. Think of it in three distinct acts.
Okay, Act 1 is puppyhood, building the foundation. Right.
Exactly. You are fiercely protecting a physically developing spine, socializing them, and establishing those ambient habits like ramps and lifting.
Getting them used to the rules while their brains are impressionable. Then they get 2 or 3, and we enter adulthood, which honestly sounds like the hardest part.
Act 2 is the slog of consistency. The novelty of the puppy is worn off, your life is busy, and it's tempting to cut corners. It's about keeping habits going when nobody is praising you for it.
And finally, we reach the senior years.
Act 3 is adaptation. You don't abandon the core principles, but you calibrate. Slower walks, more scent work, hypervigilance on the baseline, and more frequent vet check-ins.
The source makes one final, really empathetic point here. Responsible breeding sets great expectations, but a lot of people rescue or adopt older dogs with zero genetic history.
Right. Genetics deal the hand you start with, but your daily choices dictate how those cards are played.
Right, it's what you do today.
Even with poor genetics, keeping a dog lean and protecting their spine massively improves their quality of life. You start exactly where you are today.
So what does this all mean? If we look at our completely filled out index card, the secret to a long, healthy life for a dachshund isn't magic.
No, it's not.
It's the product of an informed, highly observant owner maintaining lean body weight, protecting that suspension bridge spine, and partnering with a trusted vet.
If we connect this to the bigger picture, I think there's a profound takeaway here that extends far beyond pet care. This whole concept of intimately knowing a baseline of normal through small, mundane, daily habits challenges you to look at your own life.
Yo, I love that.
Right. How well do you actually know your own physical or mental baseline? Are your daily habits quietly and consistently building your own longevity?
Yeah.
Or are you just waiting for a catastrophic emergency to finally force a change in your routine?
Oh, wow. That is a heavy but deeply necessary question to ask ourselves. The mechanics of longevity, whether you have a long spine and short legs, or you're just a human trying to get through the week, really are built in the quiet, completely unglamorous moments of our everyday lives. Thank you so much for joining us on this deep dive into the Dachshund Health Academy's findings.
Thanks for having me. It was great.
Just a quick reminder, while we've loved exploring the mechanisms of this with you, we aren't endorsing any specific medical advice. Always talk to your own medical professionals for that. But we hope this exploration brought you some real clarity and gave you a new lens of confidence for your own learning journey. Take care, and we'll catch you on the next one.